Health insurance is not the same as having access to care, and the recent insurance premium hikes are proving it to everyone. You already know the truth, y'all. The insurance mafia sucks, and they're not going to get any better. So the real question is this: what can we actually do about access to care? My name is Golfran Rivera. I'm a family medicine PA, and I'm also the founder of TrueCare DPC here in Fayetteville, North Carolina. If you give me a few minutes, I'll walk you through what's actually going on, and if you stay to the end, I'll give you some resources to help you step outside of the insurance games altogether. So, as you probably know by now, across the country, insurance premiums are going up. Now, this shouldn't surprise any of us, okay? The insurance mafia exists to make profits, and one of the ways they do that is they keep raising up the premiums. What is surprising for many is the extent to which it is going up. Now, that is due to a lot of politics and very complex policies, but we're not going to get into that. What I want to emphasize for you is that this is standard operating procedures for the insurance company. And so the question we have to ask ourselves is, do the rising insurance premiums actually translate to improvements in healthcare? Does it actually improve our access to care? Does it make it faster for us to get care? Are we improving patient outcomes? I think most of us are aware that the answer to that question is no. The insurance companies making more money is not actually improving care for us in this country. And despite that, we keep accepting this whole system as normal. Over the past few weeks, I've had conversation after conversation with different people, some of them patients, who are concerned about how they're going to cover this increased cost in insurance premiums. Many of them have actually tossed around the idea of going without health insurance. You might have even seen online that people are declaring they're doing it. They're shaking off the insurance mafia and they're going to go without insurance. And what stands out to me, though, is that this makes a lot of people nervous. And I understand why, but also what we have to realize is I think part of the reason we get nervous at this thought is because we have been conditioned to believe that having health insurance is the same as having access to care. But if you've ever actually tried to use your health insurance, especially out here in Fayetteville, you know that that's not necessarily the case. And that brings me to direct primary care. So at TrueCare DPC, which is my practice here in Fayetteville, we adopt the direct primary care model, or DPC. With DPC, patients are members of the practice. They pay a once-a-month membership fee in exchange for comprehensive services. Using my practice as an example, adults today pay $85 a month and children are $25 a month. For that membership fee, they get direct access to their provider via text messages, emails, and phone calls. They get access to routine screening labs 3 times a year already covered. They get over 1,000 generic medications shipped directly to their door at no additional cost. And they get as many visits per month that they need, a lot of times same day or next day, without having to worry about waiting rooms, crowded waiting rooms, or delayed with bureaucracy and all kinds of portal trees and nonsense, stuff like that. Now, when people hear something like this, they automatically assume that this is the perfect setup for those who don't have insurance, but it's not necessary for those who do have insurance. And the wild thing is that, yes, many of my patients don't have insurance, and they would agree this is great. But the crazy thing is that the majority of the patients here at TrueCare DPC actually do have insurance, all kinds of different insurance. We're in Fayetteville, next to Fort Bragg. There's tons of patients that we have here that have TRICARE Select. But the reason these patients come to TrueCare DPC is because they already know better than most that having insurance is not the same as having access to care. They know that that little insurance ID in their wallet doesn't mean that they're going to get care when they need it. In Fayetteville and the surrounding areas, a lot of providers don't accept many different types of insurance plans. And the ones that do accept them are overwhelmed and bogged down by taking on those additional patients. So what ends up happening is that in the area, a lot of people are slowed down by bureaucracy, surprise billing, prior authorization, delays in cares, and you know all the drill. And so a lot of people here, even though they have health insurance, are still relying on urgent cares and ER visits to handle routine care because they just can't get in to see their primary care provider. I think something that really surprises people who have insurance is when they find out that a lot of times the cost can actually go down for them when they don't utilize insurance. I still remember my patients' eyes when they discovered that an MRI that had been ordered for them that they were going to use insurance for, the deductible they were told they were going to pay was going to be close to $3,000. We got a cash quote for that MRI for $300. Many labs that insurance companies are willing to pay for can provide a bill of over $250. Meanwhile, the cash price for those same labs can be as little as $20. People can sometimes pay hundreds of dollars in co-pays every single month for medications that the insurance companies say they cover. Meanwhile, through DPC partners, you can get generic medications at no additional cost to you shipped directly to your door, a 90-day supply. But at this point, usually people object and say, okay, I got that, but what about emergencies? What if I end up needing to go to the hospital? What if I have to get taken by an ambulance? And those are fair questions. But that's the thing, right? Is that insurance is meant to be for those emergencies, not for routine care. In fact, when insurance came on the scene, that was originally what it's intended for, right? But just like your car insurance is not there to pay for gas, for replace your tires, get a new windshield wiper, your insurance shouldn't be there for routine care. And in my opinion, instead of having expensive, bloated insurance policies that at the end of the day don't really cover anything and transfer the cost to you, there are better alternatives, such as one of my favorites, health shares. Now, health shares are not insurance, but they do function as a community-based way to cover unexpected, expensive healthcare costs. There are many great health share communities out there. Some are religious, some are not. At TrueCare DPC, we partner with Zion HealthShare, which is a non-religious community. So with Zion, you choose an initial monthly membership level and what's called an initial unshareable amount. That's similar to a deductible, but it's a lot more flexible and a lot easier to understand. If an emergency happens, you pay that initial unshareable amount, maybe $1,000, and then Zion takes care of the rest. Now, my favorite part about this is that for the whole year afterwards, any event after that initial event that's related gets covered under that initial unshareable amount. Meaning, let's say you do have an emergency trip visit because of a car accident. You pay, again, we'll go with $1,000, okay? You pay that $1,000. Everything else after that that is covered gets paid for by Zion. That includes any follow-up specialty care, any needed surgeries, and any PT or whatever after that. There are no repeated copays, no surprise bills, no cost share games, just one amount and then peace of mind. And because you're technically a cash patient, you actually get access to a lot of cash discounts that most medical providers offer. I also like the fact that Zion includes coverage for things that a lot of insurance providers don't cover, like acupuncture, massage, and chiropractic care, and all that couples perfectly with DPC. So direct primary care handles your day-to-day routine care, medication management, labs, access, all that kind of stuff, while a health share or a catastrophic plan covers all the big emergency stuff, right? This combination gives you reliable access while dramatically lowering the overall cost of your healthcare. Now, for some of you, health share isn't an option, either because you just don't like the idea or frankly, you don't meet certain community guidelines because it is a community, right? And you have to go the way of insurance, but you don't need to get all the bells and whistles. You can go with what's called a high deductible health plan or a catastrophic plan, again, that focuses on covering things in case of an emergency, and you still couple that with direct primary care to get all your routine stuff cared for. Here's the bottom line, y'all. Insurance companies exist to make money. They're not going to change. They have every incentive to increase premiums, restrict access, and push the cost onto patients and providers. Asking them to change is like asking them to stop being what they are. So the solution has to come from outside of the system. And that's why the combination of DPC and health shares works. It gives you real access, predictability, and affordability so that you can have a healthcare experience that actually makes sense. Now, if you're in Fayetteville, North Carolina, or the surrounding area, I invite you to check out our website at TrueCareDPC.com, or you can text us at 910-758-1769. and let us help you take control of your health. As promised, I've included a guide that provides information on multiple different health share opportunities so you can make an informed decision for yourself. We partner with Zion because we love what they offer, but the goal here isn't to promote any one company, rather to give you all the information you need so you can make a better decision for yourself and for your family. Now, thank you guys so much for taking the time to watch this. God bless y'all. Make sure you hit that subscribe button. You share this with your loved ones if this has been informative for you. And don't forget to follow us on Facebook, TrueCare DPC.